Prostate cancer affects more than 3 million men every year worldwide. 1 in 9 men in the U.S. will be diagnosed with prostate cancer. September is Prostate Cancer Awareness Month, and joining us now is Christine Jones, CEO of the Prostate Cancer Foundation. Christine, nice to have you here.
Thank you for having me very much.
All right, so this is one of those uncomfortable conversations for men to have, but it's so vital and so important. I became a believer at age 40, so let's talk about why it's important.
Well, the first thing to know is the statistic that you just read is 1 in 9 men will be diagnosed with prostate cancer. And even more critically, 1 in 6 African American men. So prostate cancer is like the breast cancer for women in the men's side. And the reason we do this awareness campaign is because the good news is if you're diagnosed and treated early, you basically have a 100% chance of survival.
That's incredible. It just doesn't happen, right? I mean, in cancer, really, rarely does that happen.
Yeah, so the Prostate Cancer Foundation was formed about 25 years ago, and over that amount of time, the death rate has declined more than 50%. I mean, we sort of estimate about 1.3 million men are alive today because of the work of cancer researchers, but there are still this critical number of men that are going to get the disease. We want people to know if you don't have any family history, you should begin getting checked at 50. If you have some history or you're African American, you should begin at 40. And the good news for men who don't like to talk about this uncomfortable subject is starts with the blood test.
Yeah.
You're going to get a blood panel anyway for the most part, right? So you just start to track these numbers, and then if, God forbid, it looks like there's something wrong, then there's another series of tests that can be done. But this is completely about bringing awareness that you have to pay attention to it. It is the single most common cancer among men, and we want you to be well. We want you to be healthy. We want you to have another Father's Day, another birthday, all of these things.
Is this something that, as a patient, you should suggest to your doctor? Because if you're, let's say you're going in there for a cold or something you don't feel right, you should just say, hey, it's been a while since I've had a blood workup. Can we do that? Is that something we should do? At
a minimum, right? So we find that even doctors are not always suggesting to their male patients who are age appropriate to get the screening test. It definitely is between you and your doctor, right? We don't mean to dispense medical advice on your show today, but it's a really simple question. It's just like women with a mammogram or some kind of breast screening. Just ask the question and say, I want to know what my baseline is, because the critical thing to be aware of is your number rising over time, right? So if you know what it is and you know there's a change, then you're going to say, do I need to do some additional screening?
Dispel the myths for us, because there's a lot of myths and a lot of reservations among men, and a lot of things that we say and think are real but aren't real.
Well, one is that erectile dysfunction is ubiquitous among prostate cancer patients. That's not true. Another is that you automatically have to have surgery. That's also not true. There now is a whole doctrine and a whole philosophy around no treatment at all for people whose PSA is rising very slowly. They just do what we call active surveillance. So you don't have any treatment, right? Yeah. So there are lots of myths and lots of terrifying things for men that are related to their manhood, right? Nobody wants to talk about the things below the belt.
Right.
That we really encourage people not to be scared about. And if, God forbid, you have a very severe form and you have to have all of the treatments and all of the surgeries and all of those things, there actually are great ways to help improve the side effects on the back end. Yeah.
So let's talk a little bit about, so they find something and you have to have some treatment. What then?
It depends. There are a variety of different types of cancer and different types of cancer cell. And now what we know, having done this for 25 years, is that the cancer is much less about your anatomy and much more about your genetics. So the same kind of genetic trait that causes a particular kind of breast cancer also causes a particular kind of prostate cancer. So really, you get diagnosed, you understand what kind of cancer it is, and then you'll have treatment recommended. And so it's anything from the traditional 3 pillars, which would be chemotherapy, surgery, and radiation. We've now added a 4th to that because of the great work of brilliant geniuses who've done research over the last 25 years, which is very precision immunotherapy, which essentially tells your immune system to turn itself on at just the right time and just the right place to fix itself. So there's a whole variety of things that can be done. It is. The other critical thing to know is that you can do things to prevent or at least reduce your risk. And we're actually publishing a brand new wellness guide September 1st in conjunction with Prostate Cancer Awareness Month, which will help people to understand what should you eat and what kind of exercise should you do, what should you avoid, right? They're just some simple things. You literally, Carlos, should be consuming 4 tablespoons of extra virgin olive oil every single day.
Wow, that's a lot.
A lot, right?
Yeah.
You could literally drink it out of the bottle, okay? Just that, right?
Wow.
Broccoli, probably the most
I love broccoli.
incredible food. There's now a particular form of broccoli that you can eat that's even more beneficial. So easy stuff that you can do to help you prevent it, and then also things that you can do if you're diagnosed to help the treatment be more effective.
Where do people go to get more information?
So definitely don't go to Dr. Google, because Dr. Google will terrify you. You should go to our website, pcf.org. We have an enormous number of free resources, okay? And we get comments back from patients every single day saying either, thank you so much for the patient guide, it defined my entire journey, or in Drew Pinsky's case, thank you so much for the guide, it saved my life.
Wow.
Right? So those resources are critical, and it's not just for men with prostate cancer. Our research now is impacting more than 70 forms of human cancer because they tend to be genetically linked.
Sure.
So this matters for your entire family. Those 70 forms of cancer also include the 3 most common in children. Yeah. So get the free resources at pcf.org. You know, the most simple, free, important thing that anybody on your audience can do is share this message. Talk to the men in your life. And women, I'm telling you, you're the compelling ones on this. Men listen to you. They don't listen to themselves, right? So the women have to
sometimes we listen to the women.
the women have to get the men to go get
That's
screened.
right. Well,
yeah.
Christine, thanks so much. Appreciate the information, and check out the website.
Yeah,
And
thank
we'll
you for having us. We
absolutely.
really appreciate it.
Thanks very much.